This is Sarnia Lambton Daily for Thursday, May 28th. Good evening, I'm Terry Doyle. There has been another death in Sarnia Lambton due to COVID-19. A resident of Vision Nursing Home passed away over the past 24 hours. This brings the number of residents who have died at Vision to 7, the most of any facility in the region. There have now been 24 residents who have tested positive for the virus there overall. At least 8 of those residents considered recovered. Meanwhile, 24 staff have also tested positive since the pandemic began. This has put a major strain on staffing at the facility, with Blue Water Health providing 15 of their staff to provide support. Overall in Sarnia Lambton, there were 7 new positive cases diagnosed yesterday, 5 associated with Vision, 1 resident and 4 staff. The number of people recovered went up, bringing the total number of active cases to 49. Blue Water Health and other regional hospitals have announced a plan to resume hospital services, including surgeries that were postponed during the pandemic. It will be a staged resumption while ensuring resources remain available in case the hospital receives a surge of COVID-19 patients. People whose surgeries were postponed are not to call the hospital, but wait until they are contacted by either the hospital or their doctor. Let's check in with another organization in Sarnia Lambton that we know is always busy, but has certainly during the pandemic has to make some adjustments. There's Brad Webster, Lieutenant from the Salvation Army, joining us now. And Brad, right off the bat, let's talk about when the pandemic hit in March. What sort of adjustments did the Salvation Army have to make when it came to the service and the mission there?
Right. For us, as soon as the pandemic hit and things started to close down, we actually had to adapt a no-contact food bank service here. We went from a walk-in food bank to by appointment only, which kind of limited our availability to the public. And in that response, we increased our hours to make sure we weren't limiting how many people we could actually see a day. So it kept us in line with how many people we were seeing on average. But that was one of the hardest things to implement. And we kind of went down to a skeleton crew to make sure as well that we were treating our employees / volunteers, making sure that these social distancing rules were followed and so forth.
We've seen that some commercial establishments have shortened their hours. Did you find by expanding yours, just in that mode itself, allowed it social distancing and physical distancing, made that happen a little easier because you could spread people out in terms of the times of day?
Right. So what we adopted was a 15-minute appointment window. We're pretty good at getting people in within 5 to 10 minutes and getting them serviced and on their way within those 10 minutes. And it gave us that 5-minute gap between appointments so that we weren't having any overlapping appointments and people weren't coming into contact with each other outside the building either. So yeah, it was a pretty good implementation. It went over well and it seems to be working.
I'm sure for your staff it was certainly an important time as well, because especially when this first started March and into early April, wanting to keep the service running, but at the same time everyone was on pins and needles a little bit of how this was spreading, and I've got to think that's where the staff, I'm sure, really stepped up to continue to help provide the service.
Right, we have a very dedicated staff here who are very passionate about what they do, and even with the emergency ordinances that were in place, we adopted those. We made sure everybody had a PPE, mask and gloves, and that we were observing that 6-foot distancing. So our employees were right on board to do that.
Did it take maybe that first week or two for people to indeed buy into the appointment only when they were used to just dropping in?
Right. Of course, changing your methods is hard to get out there, especially the people who, were walking in daily. So in the first week, yeah, we had to explain to some that this is the reason why it's happening, but it seems to have smoothly transitioned into that.
So how are things now as we've now moved on to basically, as amazing as it might sound, more than 2 months into this, how have things been going right now?
It's been going great for us and the people we serve. We've had a great buy-in by the community, so donations have stayed constant and steady, allowing us to serve as many people as we can. We've seen an influx in new people, families that we typically haven't seen before, who, before the CERB came out and things along that line, had no idea where their next meal was coming from, or had no idea how they were going to make the adjustment between, do I pay a bill or do I put food on the table? How do I, feed my kids who are typically at school with lunches and so forth. So we've seen a lot of new faces come through our door, which is it's great knowing that they know where to go if they need help and they're able to reach out for help. But it's also sad on the other level that it has come to that. So it's a double-edged sword, really.
Do you find even in those 15-minute visits, sometimes, especially those people just reaching out for the first time, just being a face, being a friendly face in that difficult time maybe helps them, where the state when they come in versus the state that they leave, they've left with some things, but also just had someone that's been there and showing that someone cares? I guess I'm sure that must help a lot.
Typically, yes. It's that face-to-face contact is a chance for them to download some of their feelings, for them to download and connect with another human being on a face-to-face level, knowing that that's going to be kept in confidentiality, knowing that I'm not going to see them in the store and approach them and say, "Hey, remember me from the food bank?" So it gives them the opportunity to have that candid discussion with one of our employees or one of our volunteers, and that's on a regular basis. Previous clients and new people who are coming in.
With the additional number of people coming in, has that made things a little bit more of a challenge when it comes to keeping stock? And as you said, obviously you said donations have been keeping up and getting some funding as well, but I've got to think that's still a little bit of a push and pull.
Right. We were kind of concerned in the beginning, and we did have a period where we saw our stock levels drop very low, and we were concerned about where we were going to go from there, knowing that, everybody was in the same situation and that funding for them was just as tough as it was for us. But the community has really, it's inspiring to see the generosity of our community. I mean, we get mailings every day with letters saying, we're so happy you're here. We're keep up the good work. And it's inspiring to us to receive those kinds of communications that people are out there still caring for other people. If it wasn't for the community, I mean, what could we do on this level? So we're kind of the middleman. We accept the community donations and make sure it gets into the hands of those who need it.
When a lot of people would see, of course, and know about the kettle campaign that goes on around the Christmas holidays, but what about during the year? Where does sort of some of that funding and donations come from? Is it just sometimes just random donations? How does that work?
So this is a great time to actually expand on that kettle campaign. So this is where the funding goes. This is what we prepare for. We've always thought, if a disaster happens, this is what we're here for. On top of all the other programs that we run and participate in, this is what the Salvation Army does, and that's what we're here for. But we've also seen funding coming in, private funding from just somebody who drops off $100 and doesn't want any recognition. They drop it off in an envelope, don't want a receipt, don't want anything, and we've seen quite a bit of that over the last couple months.
So where do we go from here? We are still obviously waiting to see how things play out, both from the virus, both from reopening and things like that. But as you look ahead, what are the plans for the Salvation Army in the next weeks, months ahead?
So right now we are continuing with our daily food bank, as we typically do, through appointments only. On June 6th, Saturday, June 6th, between 10 a.m. and 12 p.m., we're having a drive-through food bank. And we saw a gap between people returning to work, so transitioning from CERB or EI, whatever they may be on, back into the work environment, which may or may not leave a gap between pays. So what we've decided to do is on Saturday, June 6th, is to open up a drive-through, no contact food bank. So anybody who's in need, there's no qualifications. You drive in, show us your ID through your car window, pull up, open your trunk, we throw a box of food in for you. And we're hoping that helps fill that gap.
That's certainly something for people to keep in mind out that first weekend in June there. We've talked to food bank, but I know the Salvation Army is involved in many other things as well. Obviously during pandemic things may change, but what are some of the other things that the Salvation Army does? So
we also have a rent and utility bank that we help out with, people who have fallen behind in arrears in their utilities or their rent. We are partnered with the County of Lambton, United Way in those areas. And we offer, how much time do you have to offer the programs that we offer? We have senior programs that happen here at the building. We have youth programs that happen here at the building. We do a lot of community outreach. We had plans for the summer for barbecues and community barbecues. Unfortunately, in the environment we live right now, those things have to be put on the back burner and put on hold. But our programs will be back up and running when it's safe to do so.
You asked how much time we have. We have lots when it comes to organizations that are helping out our community. For people watching us right now and are wondering, how can they help out?
We are accepting cash donations, of course, either mailed into our address here or dropped off through no contact donations. We're accepting food donations out front. We have a bin set up that you can just come by, drop off. There's no contact. And yeah, if you can help out in that way, it's greatly appreciated, and it will go to the people who need it the most.
Well, Brad, great job by you and the entire staff, volunteers that are keeping things going, not only during the pandemic, but 12 months a year. So all the best, stay safe, and we'll talk to you again soon.
Thank you very much. Stay safe.
Brad Webster joining us there from the Salvation Army. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. Well, we know over the past couple of months people have had to make adjustments and certain outlets have not been available in the normal form, and that includes the arts and culture community here in Sarnia Lambton. There's Sonya Blazek joining us here from the Judith and Norman Alix Art Gallery in downtown Sarnia. Sonya, how are things right now?
Yeah, things are different. Things are very different for us right now. Our learning curve is really steep. We're trying to go digital wherever we can, and it's really hard to be physically separated from our coworkers and our volunteers and the artwork, but we're managing.
So take me through when this first started, back to mid-March, and we got the word that basically close the doors, close up shop. What sort of adjustments did the gallery have to make?
Yeah, so March 17th, much like all of our other cultural institutions in Sarnia Lambton and a lot of businesses, we were notified that we were going to physically close down. So we did that. Our staff went home, and we basically had to, from our kitchen tables or our living rooms or wherever we were working from then on, we had to assess, what did we have at hand. First off, we kind of had to look at what programming we were completing. So we were just coming to the tail end of our winter programming at this time. So we had to cancel any of our offerings. Which programs would we be able to potentially shift online at that time, which I can get to later on. And then we had to also think about the fact that we had work physically hanging in the gallery. So there were a lot of contracts we had to negotiate with artists. Can we keep the work? We're not sure what's happening. We're physically closing. So a ton of communication. We had also just finished designing all of our summer programming. So all of our adult, youth, our lecture series, of course, our exhibitions that were coming up for the summer, all of that was coming to a head, and we were getting ready to produce our brochure. So of course, we had to contact all of the artists that we were going to be working with and cancel all of that offering, which was, it's hard. Artists are being tremendously impacted by this. And so we also had to apply for extensions for grants. So if we were on our way working through a specific grant and we couldn't physically complete it because we could not be in the space. So a lot of, like I said, communication, writing requests for extensions, letting artists and other galleries know what was the reality for us and who they could still contact. Yeah, so that's kind of, all of our tours were suspended. A lot of our day-to-day communications and interactions with our volunteers, all of that quickly came to an end. So that was kind of a big shock for us.
I guess, and of course, any gallery would be dealing with the same thing right now, especially, well, across the country and across, you could say across the world, but definitely across North America, where, for example, if there was a work that was due to go back, I'll just say the end of March, and the artist was expecting it back, well, obviously that wasn't going to happen because that would mean gathering staff, getting everybody close together, the proper care of it. And I guess that's where I would hope the artists would be understanding that we're all in this right now. It's not like the work was going to be able to go to another gallery right away as well. Was that where sort of the community sort of, while it wasn't easy for everyone just tried to work together as much as possible?
Oh yeah, we're all trying to be as supportive and understanding as we can be. There are certain staff that still have access to our physical space. And so we are still able to facilitate, like we had a few loans that just had to go back. And so there have been designated staff that were able to make sure that those happened, following the proper procedures to ensure everyone was safe. But yeah, we're dealing with a ton of requests. We have work out in Newfoundland, we have work in Barrie, we have work in Toronto. And so a lot of requests requests from people saying, hey, we hope you can, extend our request. So we've been, wherever possible, we've of course been agreeing to extensions, because we recognize that some of these shows may have only opened a few weeks before the closures happened. And then of course we're doing the same. We have a few exhibitions currently at the gallery which are on loan, and so we're talking to private owners, people that own some of the artworks, the galleries that loaned the exhibitions to us, and then also 5 different artists whose work we have. But I have to say everyone is being extremely supportive and understanding and patient, and so I really can't complain. It's been really incredible.
You touched on something there that I'm going to be honest, I wasn't completely aware of, maybe not understanding, that obviously there's the work that comes into Sarnia, but as you said, there's work that belongs to the gallery here that is also loaned out to other places.
Yeah, it is. Yeah. So we kind of juggle all of these different things. We have the things that you see physically in the gallery when you come and visit an exhibition, but our permanent collection has this little life of its own. And some of the paintings are better traveled than anybody else on staff. Like one work is in Toronto right now, and potentially will be traveling overseas to Germany for a huge exhibition. Yeah, so they're getting a bit more travel time than any of the staff are able to.
So what's going on now in terms of adjusting programming? You mentioned, of course, some of the summer tours and exhibits have to change, but we're in a digital world now. We're in a virtual world to a certain extent. That's how you and I are chatting right now. What sort of things can and can't be done in that area?
Yeah, so we wanted to look at what do we still have. So we may not physically be able to be in our building, but what forms of communication, what access do we have to the community so that we can still serve them, but from a safe distance. And so, of course, we have our social media platforms. We got Facebook, we have Instagram, we have our YouTube, and we have our website. So then we started thinking, all right, if we don't have access to the physical space, what's on our cell phones? Like, are there install shots? Have we been working with specific pieces that we have pictures of on our cell phones? Do we have access to JPEGs of our permanent collection? So kind of taking a tally of all of these things. And then, like I said, looking at which programs could be easily translatable and still have impact online. And so our first project, we were just coming to the close of our Art and Ideas lecture series for the winter, and we had one lecture left, and we thought it was a really important lecture to still deliver to the community. It was about contemporary Indigenous art. We were partnering with a curator out of Brantford, and so I approached him and said, hey, I'm trying to learn all these programs, Zoom, Marker, Google Hangouts. I would really love to be able to still offer this lecture. Would you be willing? And so together we practiced a few times. I selected Zoom as our format for offering the lecture. And I also extended the invitation that since we were offering this digitally and we didn't have to worry about this distance traveled from our participants, if somebody wanted to join us from further away, I asked him if he would be interested in inviting his members of the Brantford Gallery as well. So it's called the Glenhurst Art Gallery. So they extended the invitation. We managed all of the registration. We had 72 people register. And then the night of the lecture, we had 49 people attend online. And that was from all over Lambton County, as well as Brantford and the GTA, which is a group that we would have never really been able to access before. And the lecture went off without a hitch. Which was great. And we also were able to record it and offer it out to people who had registered and weren't able to make it that evening. And it's also on our website. So I have received a few emails from people saying, I really appreciate the fact that it's been recorded. I wasn't able to attend that evening. Something came up and I could enjoy it at my own pace and at my own leisure. So I've had, so I feel really good that some of these things that we've kind of pivoted online have had these really beneficial side effects as well. So that's something that we were able to complete that winter series, offer the lecture, this service that we still like to give to the community, and it turned out to be a bigger success than we even anticipated. which is quite nice. And then also, because we're working with the permanent collection through these JPEGs, and because my attention is so focused on social media and what's being produced online right now, we're still continuing our From the Vault series, which is very popular, where we feature one work from our permanent collection and we discuss it in detail. So that is ongoing. But I also noticed that hashtags are this new way that galleries internationally were starting to communicate with each other. And so it kind of started with this museum bouquet movement. And then it evolved into Museum Sunshine, Museum Moment of Zen. And so some people may have seen these trending on Instagram or posts related to this on Facebook. And so I thought, what a great way. I'm looking at, over 1,200 works of art in these little JPEGs on my screen. And I'm trying to produce content online, but how we can also enter in this international discourse about art and also support each other by participating in these trends. And so I started to see that certain works in our permanent collection spoke to some of these trending hashtags, like museum bouquets. We have some beautiful historic paintings, still life paintings of bouquets of flowers. And so I developed a social media sourced exhibition. So people can actually go on our Facebook or Instagram, and I've pitted certain paintings against each other that fall under the same hashtag and asked people, which one do you prefer? Because I may prefer something that's more non-representational or more historic, but you may think otherwise. And I'm sitting in my kitchen looking at these JPEGs, and I may like certain things, but I kind of want to hear what our community likes. And so we started doing this voting system, which you can see on Instagram and on Facebook, and people can simply just vote for which piece they prefer. And then the hope is eventually we'll actually install them physically in the gallery, and then people can come and see them in person. So that is one way that engaging with the permanent collection has really evolved through social media for us. And then also we've been participating in any other virtual movements. Museum Week was not that long ago, May 11th to 17th. We produced content for every one of those days. And one of my favorite being we challenged the community to recreate some of our favorite pieces from the permanent collection. And so we received some outstanding submissions. One of my favorites being a recreation of our famous Holgate lumberjack. So those are all saved on our highlights on Instagram as well. So I encourage you to go and see those or recreate works from our permanent collection and then tag us or send them to us.
It has been quite busy, and sounds like indeed that idea of almost like a People's Choice exhibit with some of the things that were voted on. You talked about when you're ready to open the doors. Obviously public health and the province are going to have a big say in that, but what sort of the preparations in place and what are you looking ahead towards so when the day comes that you'll be ready to go to open up?
Yeah, so we're doing a lot of research into what the different stages might look like for when we prepare to open. Of course, we'll be implementing a lot of the safety protocols that people are experiencing when they already go to the grocery store into public, like the plexiglass and hand sanitization stations. Yeah, so our library will probably be the first to take on some of these initiatives. So we'll be looking to them as an example. Yeah, it's probably the hardest part is the uncertainty of when we'll open. But we're doing our best to plan for every scenario, you know, whether it's discussing how public will travel through the gallery spaces or through the gallery in general, how staff will interact with each other, how we'll interact with public. Yeah, it's a very complicated question and something that we think about daily.
Well, Sonya, sounds like things have been quite busy and very creative, which is always a great thing to see, you know, being creative, still trying to engage people as much as possible. So we appreciate the time. Great job there, and we'll talk to you again soon.
Thank you so much.
There's Sonya Blazek joining us from the Judith and Norman Alix Art Gallery here in Sarnia. Stay tuned. You're watching Sarnia Lambton Daily on your TV. That will do it for Sarnia Lambton Daily for this Thursday, May 28th. Thank you for joining us. For all of us here at your TV, I'm Terry Doyle. Have a good night. We'll see you back here tomorrow.